evening and welcome to another episode of Bula Wellness. Thank you for joining us tonight. I trust that you have been enjoying the show so far. I also hope that you have been learning a lot from everything being shared on the show. 2 weeks ago, we discussed the very important subject of the global crisis of non-communicable diseases, that is, increasing obesity resulting in diabetes. We have also discussed what we can do to improve the quality of our lives. This week, we look at the subject of NCD again and see how it affects the heart and its arteries. We know that diabetes accelerates the damages to the heart and its arteries. Today, we will raise public awareness to greater heights to encourage individuals, families, and community to actively relook at their lives, to seek assistance to be screened for early evidence of heart disease with our health teams. You must not forget that prevention is always better than cure. Heart disease is reaching epidemic proportions in Fiji as a result of our lifestyles. What do we mean when we talk lifestyles? That is how we live our lives, what we eat, drink, smoke, breathe, and how we spend our time. Leisure and physical activities included. Obesity increasing childhood ones, high stress levels, high sugar consumption, diabetes all contribute to heart disease. Young people in their 20s and 30s are presenting with NCDs related heart disease, including heart attacks in our health facilities. Some end up disabled and some die prematurely in the prime of their lives. We are the first generation of people on this planet who are bearing our children because of NCD related heart disease. Our team went out and about to find out what you know about lifestyles. Let's see what you had to say.
I think a lifestyle disease is the disease that catch you up on your life when you start from when you're just young up to when you're old. But sometimes on the middle of your life it comes in, what you eat, what you do, that causes lifestyle disease. That's what I think.
I believe lifestyle diseases, also known as non-communicable diseases. These diseases are those diseases which one gets if they're not careful with their lifestyle, how they live their lives. This includes, in lifestyle, we're talking about what they eat, what they drink, things they do every day. If there's, and especially if you're talking about if they don't work out, all those things, they matters, and all those things, they can lead up to people having those kind of diseases.
What do you understand by lifestyle disease? Actually, not really.
As a former military man, I spent more than 30 years in the military. But now I'm out from the military and spend some years back in outside there. And I try to cope up with what I used to when I was a kid. I used to play rugby when I was young, but I try to keep myself fit. So you can see I've got 5 grandchildren. I just, he asked me, "Granddad, if you can go for some walk." I said, "Okay, hop in, you come on the car and you walk and do some exercise on this slow park."
I can say I have the ideal lifestyle, the ideal healthy lifestyle, but I can say I try to eat only 3 times a day. I don't have meals in between, and to keep my cholesterol and everything in check, and also try to have my daily intake of fruits and some greens every now and then for my meals, and just starting from last 2 weeks, I started working out. I'm going for Zumba twice a week, So those are my attempts in keeping myself fit, not only fit, but healthy.
So basically, I do like training, running along the coast, and I go to the gym for workout. So usually after work, or sometimes I'm busy, so I come here for jogging, and then I go back to my office.
As I'm getting older now, I try to eat not so much food that I used to eat when I was I was very active. But now I eat less, especially in the evening.
I think it would be increasing my because now I just work out 2 times a week. Maybe increase it to maybe every day except Sundays. A 30 minutes walk every day if I don't work out, and maybe eat more fruits and vegetables. I mean, I'll try.
Actually, I'm trying to get up earlier so I can do exercise in the morning before I go to work, but it's very difficult to get up early, so that's what I'm trying to do.
In today's program, we have a guest who will be answering some very important questions. We will discuss what is the current situation in Fiji, what we can do to raise public awareness, consider screening, and take active measures to prevent heart disease or stop effectively the progression of the disease in others. Welcome to the show, Dr. Kapadia.
Thank you. Thank you.
What we'd like to ask you is, what is non-communicable heart disease and how bad is it now?
Non-communicable heart disease is a major health problem in Fiji and throughout the world. We have more deaths from non-communicable heart disease than any other condition, and it is the same story in most countries in the world today. While it is such a serious condition, it is also largely preventable. We are really talking about disease of the arteries of the heart and the secondary effects that occur on the heart, heart attacks and subsequent problems. It's also associated with other conditions like high blood pressure and diabetes. And these are also related to lifestyle issues, smoking, poor dietary habits, and physical inactivity. So a lot of it is very serious, at the same time largely preventable.
That is very interesting, Dr. Kapadia. I'm sure everybody watching today would love to know more about this problem. Stay with us because we've got more coming up right after this. Welcome back to Bula Wellness on FBC TV. We are talking to Dr. Vijay Kapadia, a renowned cardiologist among the best in the field. He is also known as the father of modern cardiology in Fiji. Welcome again, Dr. Kapadia.
Thank you. Thank you for your kind words.
Earlier, you were talking about the severity of this problem in Fiji. Now, to elaborate more on this, can you please tell us about the growing number of cases presenting with NCD-related heart disease in Fiji?
Fiji has had a problem with non-communicable heart disease or coronary artery disease for many years, and it's just getting worse. There are more people dying from it than in the past, as the disease incidence is increasing because of lifestyle, dietary habits, and smoking issues. At the same time, we have to double our preventive measures, encourage people to exercise, to change dietary habits, and also to do prevention and have their checks done appropriately and present themselves to doctors and have investigations so that we can pick up the disease early and see if we can treat them and prevent complications and even death.
Yes, it's very interesting because previously, 20, 30 years ago, people were dying of infective diseases. Now, 80% of our deaths are due to non-communicable heart diseases.
Very true.
What is the relationship between diabetes and NCD heart diseases?
Diabetes is very closely linked with NCD and heart disease. particularly the type of diabetes that affects people as they get older. Here there are other associations. Diabetes is associated with high blood pressure, with high cholesterol, and with disease of the arteries, particularly involving the heart, the brain when they can have strokes, involving the kidneys, the legs, because then they can have amputation. So diabetes is very closely linked to heart disease in general. And the leading cause of death in diabetes is heart disease. People die from heart attacks when they have diabetes, and that's the main cause of death in a diabetic patient. Diabetes promotes the development of narrowing in arteries, and when it happens in the arteries of the heart, the biggest problem is heart attack and death. So there's a lot of death from heart disease more than any other condition when a person has diabetes. So when you have diabetes, you have to look for heart disease because there's a very high incidence of heart disease in a diabetic patient.
Now, what would you say to the public if they wanted to reduce the risk of NCD-related heart diseases?
Well, as we said, while it is very serious, up to 80% is said to be preventable. The best thing is to encourage good lifestyle. So regular exercise, at least say 30 minutes brisk walking or other good physical activity 5-6 times a week, 30 to 40 minutes a week. Healthy eating habits, a lot of fruit, a lot of vegetables, and smoking cessation. There's a high prevalence of smoking in the country. Smoking accelerates all these non-communicable diseases. So these three big interventions can go a long way. So if we can reduce weight, look after these aspects as I said, and also have one's blood pressure and cholesterol and blood sugar checked on a regular basis. And if these are increased or abnormal, have them treated again on the basis of lifestyle and simple medications if needed.
Thank you. In fact, what you have said is very, very simple, and people need to take note that smoking is not healthy, that you need to eat right, you need to exercise, and you need to be screened regularly beyond 35 years of age because of the high morbidity
Very true.
and the premature deaths which arise. What facilities does the public sector have now to assess heart disease, especially at the subdivisional hospitals in comparison to the divisional hospitals, Suva, Lutoka and Lambasa?
Well, I would say the initial assessment is not very complex. It looks at height, weight, the body mass index, whether one is obese or not, waist circumference, if one has a big waist circumference, particularly if there's fat around the waist, that is not a good sign. It increases, it's associated with increased vascular risk of heart disease, stroke, high blood pressure, diabetes. And simple checks like blood pressure, which is available everywhere, blood pressure, and if one does blood tests, which are available through most centers, checking cholesterol, checking blood sugar, simple assessments can be done. And ECG is available that can add, although it's not absolutely necessary as the first step in the initial assessment. After that, one can go further and have other more secondary level investigations done.
So what you're saying again is very simple, that simple screening of height, weight, calculating the BMIs and assessing the sugar and cholesterol, and a good physical examination is more than what is needed.
Very true.
And this is available at right down to health center level. So this patient, so this individual should ensure that they turn up at these checkpoints. What treatments are now available locally with improvement in the hospitals and staff training?
That's a very important question and important point. Treatment starts with prevention and all the lifestyle changes that we've talked about a few times already now. Then if medications are required, and medications go a long way in helping too, for the right patient. And again, they're simple drugs like aspirin, simple blood pressure medications, simple cholesterol lowering tablets, and simple medications for diabetes. These are simple medications that are easily available, and people should be encouraged first to have their conditions assessed and detected, If a diagnosis is made and if they do need treatment, they should make themselves available to have them and take them regularly. Beyond medication, there are other investigations that we can go up to also.
Would you like to make some comments about stress testing and echoes and angiograms?
Yes, I think it is important that we are able to offer our people the whole array of tests. Prevention is very important, simple medications are very important, but we don't have to stop there because there is a very high incidence of very severe disease in the country. So where there is a need to go further, we should have that treatment available. So stress test is a very useful test. It is not necessarily a great screening test for everybody, but where there is a high risk person, if he has diabetes, high blood pressure, he's been a smoker or there is a family history, even if he doesn't have symptoms, he perhaps could be considered for a stress test where there are no other more complex screening tests available. It's not a bad thing to consider that in the high risk population. An echo would not necessarily be useful for screening. Echo is an ultrasound scan of the heart, but it has its usefulness in assessing other aspects of heart disease. But where we strongly suspect that there is a high chance of important blockages in the arteries of the heart, or if one is presenting with symptoms that are suggesting a very unstable pattern, a lot of chest pain occurring at very minimal effort or at rest, and is very suggestive of heart pain, I think we have to consider angiography and catheterization of the heart through a catheter going into the body, into the heart, taking pictures, and then considering whether we can put balloons and stents to open up blockages, and even consider bypass surgery. So in the right group, this type of treatment should be available and can be very useful.
Thank you. And you would like to confirm that CWM has these facilities now?
Yes, CWM has these facilities. We have been running this for some time, and we are very thankful to you personally for having started the program when you were minister. And it's working very well. We need more support. It's an expensive exercise, but we would hope that it will continue to get more widely available.
If I developed some heart disease, is surgery invariable?
No. I would say surgery should be reserved for those who definitely need it. And if you look at it, there is a relatively small number of patients from the wide group of people with heart disease who require a bypass operation. In number terms, we do have a relatively large number who require surgery, and we have a very aggressive form of heart disease in Fiji. But not everybody who has a blockage requires stenting. The majority should be best treated with medication and lifestyle. Then some will need procedures like intervention, and some will need surgery.
Fine. Thank you, Dr. Kapadia. Finally, what advice can you give our viewers tonight about heart disease or NCDs in general?
They are serious things, yet they are preventable. So if you do regular exercise, take good control of your diet, avoid smoking, have your checks done for your cholesterol, blood pressure, blood sugar, and keep all these under control, you'll go a long way in preventing the disease altogether or keeping it under control.
Thank you for your time, Dr. Kapadia, and safe travels back to Australia. Stay with us. More will be coming up right after this. Welcome back to Bula Wellness. Today's discussion has been very interesting, and we are talking about non-communicable heart disease. From that very informative discussion with Dr. Vijay Kapadia, I managed to pick out some very important points to share with you. The seeds of obesity, diabetes, and heart disease are laid in the genetic code. Some medical personnel are becoming familiar with the term coined social determinants of health. Likewise, poverty can prevent us from developing our full potential in life. The food we consume results in NCDs. How we live and die results directly from all these events and occurrences. Non-communicable heart diseases present very silently if we do not go looking for them. Much like thieves, they pounce on you in the most awkward moment. A lot of times, NCD heart disease arrives unannounced in the prime of our lives. Heart attacks are a real possibility if we do not get screened. NCD heart disease sometimes presents as shortness of breath, severe chest pain, but in most cases, the full-fledged heart attack is the first time when we are confronted. That is, if we do not look for it. You will be undertaking a great service to yourself and your family if you review and improve your food habits, in that you cut back on the daily fat, fried, salty meals. If you can increase the consumption of fruit and vegetables, if you can teach your children about reducing the intake of fizzy, soft drinks and eating snacks which have no nutritional value but heaped with calories and salt. Heart diseases will decrease if we do not breathe in polluted air, cigarette and tobacco smoking reduced, not encouraged in young people. Dr. Vijay Kapadia reminded us of the need to look at our smoking habits. A significant number of adults smoke cigarettes, Fiji tobacco. All the pollutants are also inhaled by our neighbors as passive smoking. Fiji also has a high rate of adolescents taking up this hobby despite stringent laws, enforcement, taxation and fines. Alcohol reduced to social drinking, not how we binge on it on Friday and Saturdays in our cities, on the waterfront, parks and the cassava patches, knocked flat on the curbs and benches because the clubs are open until 5 a.m. in these entertainment areas. Looking at the bigger picture, with nightclubs open until 5 a.m., we note street fights and others knocked out on the benches and curbs. Drunken youth and young adults in our urban entertainment zones could utilize their hard-earned funds better. Dr. Kapadia also mentioned the need to eat healthy. In a lot of sectors, we are reminded that quality is difficult when so many live in peri-urban poverty. When there is no land to farm, canned food is cheaper, readily available, and sweetened sugary drinks cheaper than bottled water. A lot can be said of plant-based food and takeaway from commercially grown animals. It is heartening to see people talking about organic food production as the amount of toxins, poisons and antibiotics are reduced in such food items. Backyard farming is not taken seriously in Fiji. We will address salt restriction in a subsequent episode. Efforts to restart community exercise programs must be encouraged. Concerned stakeholders have taken great initiative, but our custodians of health are facing hindrances in maintaining the momentum. Our all-weather exercise centers must be developed around the peri-urban centers and better utilized. Tavua, Reki Reki and Nasori are the three centers who urgently need outdoor exercise walkways. Some corporate organization needs to be identified surely by our healthcare providers in governance. Screening for heart disease must be encouraged with blood and heart checks by all, as discussed by our guest speaker. All individuals over 35 years of age must be screened by their primary healthcare provider, be it the nurse, the doctor, the GP or specialist. All individuals at high risk should be treated to maintain the best quality of life. I implore you to take this advice to heart and make sure to visit your health center and hospitals to get checked. It's better to be on the safe side. Unfortunately, time has caught up with us again, and that brings us to the end of this episode of Bula Wellness. I hope you enjoyed the program. Trust you have learnt a few things that could change or even save your life and those whom you love. If you have queries about the show or the topic today, you can contact us on Facebook, Bula Wellness FBC TV, or write to us at bulawellness@fbc.com.fj. Make sure to join us again the same time next week for another episode. We will address diet and nutrition, foundation of wellness. Until then, good night for now.